4 minutes after 2 here
Yeah.
in East Coast. So we'll go ahead and get started because I want to be able to allow enough time for some Q&A or anything else that comes up. So let me first start by welcoming everybody. Appreciate you taking your time from this morning or this afternoon, wherever you're at in the state. A little bit about myself. I'm a board-certified naturopathic doctor. I'm also certified recovery nutritional coach through Christina, the Academy. And I've been practicing homeopathy as one of my main concentration. I also do meditation on a bi-weekly basis here in my main office, as well as with the addictions. And I'm a Reiki master teacher and biomagnetism therapy. So several years ago, in fact, it will be 10 years next month, I started working with addiction in northeastern Ohio, in Youngstown specifically, uh, for a very nice nonprofit organization called Flying High. So I was lucky enough and fortunate enough and blessed, I feel, that they were able to bring me aboard and work and bring this other aspect of holistic health for the addiction. And this is one of the things that I would like to talk a little bit more today. So let's see if I'm going to advance to the next slide, which usually lets me, if I press center, usually does that, but for some reason now I can't. Oh, here we go. So when we talk about holistic health, really I like to look at it three things mainly. And most of you, of course, that are joined here are probably familiar with mind, body, and spirit. Often we just talking about one aspect, the body, and we disregard the other, which in my point of view are just as important. And sometimes the mind and the spirit may be even more important than the body itself. So some of you are already familiar with the three-legged stool analogy, where for the wellness, I like to use the body, mind, and spirit. For health, of course, nutrition, exercise, and sleep. I think those are the three main pillars of good health. And we often will concentrate on one aspect, for example, nutrition, and disregard the other. And like always say, if you have one leg longer or shorter in a stool, you're not going to be imbalanced. So all three of them need to be addressed. So when we talk about nutrition, I like to say that usually we talk about diet, but in my point of view, it is just what we eat. As you can tell, and as you can see from the slide, it's also what we watch, what we listen to, what we read, the people we hang around. So we need to be very mindful of anything that enters our body via whether it's a mouth, our eyes, our ear, our mind, because all those things have a certain, excuse me, vibration or certain way that resonates with us. And to me, a good health really needs to take a good care of all those things. Alcohol and drug abuse has been not only a major issues from a social point of view, but also economically and social. You can see that just in the previous year, that has cost in the United States a little over $1.45 trillion, which includes the 508 million just coming in economic loss, $847 billion for societal harm, and to the quality of life, premature life of people that we have lost. So this is obviously something that has a major impact on all of us. And it's almost I think, impossible to talk to someone that has not been affected directly or indirectly through some sort of addiction. So, of course, I like to start with nutrition because, especially in naturopathy, that's one of the main pillar of good health. So we can see that it is one of the most influential parts, especially when we talk about neurotransmitters for the mental and physical health. I'm sure most of you have known or heard of Linus Pauling, and he won the Nobel Prize. And he says that good nutrition will actually prevent about 95% of all the disease. So when you think about that, that's a heck of a big number that we can actually prevent just by watching what we eat. And the thing that my issue is that we have to eat anyway, and we know that good nutrition prevents things, and we know how important, especially for people in recovery, good nutrition is. We should be paying more attention to what we put in our mouth. We also know that in the early phase of recovery, food is usually a substitute for drug use, and especially things that are high in fat, high in sugar, just to satisfy those cravings, just to satisfy those dopamine cravings that our brain is trying to reactivate again from the lack of whatever substance they were using. We can see from a PET scan how important or how really interesting the sugar will affect the brain, most as well as cocaine. So, in fact, there were some lab testing where it shows that rats given the option of cocaine and sugar and given both, they would go towards the sugar eventually. So it becomes even highly more addictive than cocaine. 20 years ago, if someone would ask me, well, is it just willpower? I would have probably said, well, anybody can have control on that, on what they ingest or what they put it in their system. But then after doing more and more work and working with addictions on a daily basis, we can see that willpower alone is not sufficient to overcome the addictions. There is a part of our brain that gets controlled, and the different drugs will affect the brain differently. So one of the things that is a common denominator is this chemical dependency on dopamine that goes on in our brain circuits there for pleasure and for control rewards. So you may ask, is recovery even possible? And you can look at somebody's PET scan and you can see a normal, not addicted brain versus someone that has been in recovery for a short period of time. This happens to be a meth user and someone who's been abstinent after over a year. And now the two brain between the non-addict and the one 14 months later actually are almost back to normality. So the answer is recovery possible? Yes, given the proper tools and everything else that we need from an holistic point of view, I think we can achieve it. Also, we need to understand that our body's own ability to heal is much greater than anyone has ever permitted us to believe. We often hear people falling into whatever illness or conditions and get told, there's nothing that they can do. And perhaps in some cases, there is not much that they can do. but there is still a lot more that our body can actually do that we don't even know that we are able to do it.
You just made a mess.
Hello?
That
Was
was
that a
Shelley.
question?
Good.
Oh, sure. Okay. So well, we are all familiar, at least I'm thinking by now, if you are on this call, about Julia Ross, about the neurotransmitter, the amino acids, and how they affect us. And we know that our brain is a full pharmacy upstairs. We make our own endorphins, enkephalins, which are the natural painkiller, our own serotonin, our own GABA, which is our natural Valium, and our own cats, the dopamine and the norepinephrine, the excitatory type of neurotransmitters. But we also know that when we are using substance or certain behavior, those rewards pathways get somehow bastardized with the drugs and the other behaviors. So amino acids becomes really the central part of how to start working on the brain from a nutritional point of view. We know that some of the amino acids our body synthesizes, our body makes, those are the non-essential, but we also know that there is a whole nice group of them that we need to get. We need to get it from nutrition, so we need to get it from a food, which is still the best medicine. But if people are not eating properly and they become so deficient, especially after time of usage with drugs and alcohol and other substance, they are not thinking of their diets specifically. So we need to get them somehow, and maybe even supplementing with some good, pure essential acids. I know this chart may not be so visible, but I think everybody has seen this, or at least most of us on this call have seen this. And if not, you can go on Julia Ross's website, and this is Julia amino acid therapy chart, which has become my best friend for the past decade or so, because I have people go through these and assign a score from 0 to 10 in one of those categories on type 1 in the column 1 there, and that allow us to see where the deficiency comes in when it comes to those neurotransmitters that I mentioned on the other slide. So what other approach do I use beside nutrition, which we are mostly familiar? One of the other things, as being an homeopath, I use homeopathy quite a bit. For those of you that are not familiar, homeopathy is another one of those holistic modality, has been around for over 200 years. It treats the person really in a unique, customized way, because not two individual, whether it's alcohol or a headache or a gastritis, will get the same homeopathic remedy, simply because the remedy are based on the individual specific symptoms. Just like no two headaches are the same, no two addictions are the same. Because beside the physical aspect, which might look like the same at the surface, there is a lot of undermining factors that drive that addictions. The mental, the emotional, the spiritual, and homeospatos is really coming from the Greek word of like cures like, which means that if a substance given to a healthy person causes those kind of symptoms in a highly diluted, triturated forms, it will actually be used by a body as a catalyst to cure those particular symptoms. So if you're not familiar, I know, with this concept or with homeopathy, this might sound a little alpha first, but trust me, it has been around for hundreds of years, and there are millions of people all over the world, especially Europe, India, that use homeopathy on a daily basis. Let me give you some example of what a homeopathic remedy will look like. So things like Nux vomica. This is an effective remedy for antidote to severe drug and alcohol craving, especially in the early stage of recovery. This is also one of those remedy that I have personally used if I find myself attending a party and maybe overdid it with the food, and you get up 12 o'clock in the morning and feel, oh my gosh, I feel so stuffed. I ate too much or drank a little bit too much. So reach out for the Nux vomica, as it will help ease those symptoms. Another one used quite a bit is the Avena sativa, and those really are for the mental symptoms from morphine, opium, heroin, cocaine, and it also helps the discomfort for alcohol during detox. Things like arsenicum alba, which is really made from arsenic, but because it's in those that it's highly diluted, we don't have to worry about, poisoning anybody. So that's, but it will ease the chronic dependency on DT, especially at first when people start going through a detox. And other things like Natrum muriaticum, which is a great remedy for alcoholism with chronic depressions and grief. So I just want to pause for a few seconds and let you notice that, again, depending not just on the alcohol craving, but also on the mental aspect. Do they feel depressed? Are they grieving? Is the alcohol driven from a trauma, from a loss? So in each one of those things, for an homeopath, it means something. And this is where, when you go see a classical homeopath, he or she will ask you a million questions, because we always like to say that everything means something. So, and this is just a few samples. There are over 4,000 remedies in our Materia Medica, but this is just a few that I picked that I think deal a lot with what we're talking about today for addiction. What are some of the other modalities? I'm sure some of you are already familiar with the Bach flower essence. Again, these are modalities, Bach flowers, homeopathy, that are easy to get, inexpensive. There are no side effects, so they can be incorporated even with the mainstream or whatever other detoxing, whatever other modalities they are doing, whether it's medicinal or otherwise. This can be an aid to it. Things like agrimony, that's a good flower essence for those that turn to drugs to avoid their true feelings. Maybe you know some of those people that use the substance to hide their feelings. That's a good time to think for agrimony and to take the essential oil there. Aspen, for those that turn to drugs to cover the fear of the unknown, reduce their sensitivity. Chestnut bud, it's another great remedy for breaking those strong habits and repetitive behavior. So this is using addiction not only for drugs, but also for behavioral. Clematis, this remedy is also great for those people that seek to escape from here and now, and they want it to be out of their body. These are people that have probably used psychedelics just to have that out-of-body experience, just to, I guess, hide or get away from what the body is trying to tell them and go somewhere else with that experience. So beside the nutrition, we talked about the homeopathy, the Bach flower essence. One of the things that I started doing several years ago when I became certified into biomagnet therapy. Biomagnetism is one of the things that also has been utilized for centuries. Started in South America and then finally got brought up over here by the turn of the centuries here. And you use magnets like the one you see there on the picture. They're not your magnets that you get at the old Radio Shack or maybe at the hardware store. They are specifically made for usage for therapy. They're about 1,000 to 1,500 Gauss, and they're placed strategically on different part of the area that needs the attention. And this will allow the body to adjust the pH, which, of course, we know how important pH is, because, of course, that's the root of inflammation. That's the root of a lot of issues with circulations, getting the sympathetic and the parasympathetic system back to normal and balance. And also, I've used magnets placed directly on the liver to a liver detox. And along with the Nux vomica, if you find yourself overeating or maybe consuming food that was somewhat spoiled, and you have the sensation of nausea, vomiting, or diarrhea, Nux vomica, as well as apply magnets directly on the liver, will help balance the pH and will help balance the acidity in our stomach there. So that's another one of those modalities that I often refer to it. The easiest thing that we can do, especially when I teach and practice meditations and offer meditation, is of course breathing. The breath is probably the thing that we have with us all the time. And it's amazing how many times in a day we forget to truly take a good deep breath, and we get more on a shallow breathing instead of truly filling our lungs, expanding our diaphragm with good oxygen, and then bring it all out. Because again, bringing oxygen to our system, to our blood supply, to our brain is another one of those game-changing modalities. Meditation goes hand in hand with the breathing, because when I do practice and I coach and do my meditation classes, we always start with a breath to slow down the breath. Meditation is, I found it very helpful, especially for addictions where the mind, the monkey mind still goes all over. And scientists shows us that we have on the average 60 to 80,000 thoughts per day. About 80% of those are negative thoughts, and 95% of those are repetitive. So it's almost like we keep playing the same tape over and over again in our mind, which gets done to the rabbit hole. And often, especially if we are right on the edge of not feeling well, and then we start playing this movie again in our mind, it's easy to start losing the grip. And if you didn't have enough protein in the past meal or so, and it's one of those bad days, and you keep going over and over with your thoughts, because I mentioned on the very first couple slides what consists in your diet. So it's easy then just to let go of and start picking up again. So prayer, I think, goes hand in hand with meditation. because I think that, and it doesn't have to be from any type of religion. You can pray to your higher self, you can pray to God, you can pray to whatever you believe is, where you can go to your inner spiritual awareness and make the connection to your higher power. And meditation really eliminates the dialogue that goes back and forth between should I use, should I go and call my friend, should I do this, should I do that, and it lets you often choose the right path of sobriety by overcoming anxiety, by overcoming confusions, the commotions, all those things that happen in your brain, because your thoughts really create your emotion. And when you start changing the way you're thinking, you change your emotional response. So by changing your mind, you also change your life. Exercise, when you think about the slide where it shows exercise or movement, because often when we think of exercise, people think that they got to go to the gym and start lifting weights or do something crazy. But even a good walk, today happens to be Earth Day, so a good walk in the park, it's awesome. Yoga, which sort of brings together the mind, body, and emotion, also has a lot of good benefits to it. Increase the vitality, increase the self-esteem, improves the moods, it strengthens your immune system, it promotes relaxation, it promotes an overall sense of well-being. So after a good exercise or a good yoga class, you feel better, you make some dopamine, you make some serotonin, so you're less likely to go out and get a drink. Plus, people that often follow those kind of modalities, they, I believe, have a higher respect for their body, and they look at their body more with a respectful way rather than just throwing it all out the window. Reiki, for those of you that are not familiar, it's Reiki itself. It's a Japanese word, and it's a technique that uses the laying of the hands, addressing and connecting the universal energy. In fact, that's what the word Reiki stands for. The key is the energy, and Rei is the universe. So the universal energy from your higher self, from the universe, from your God, whatever, and coming into your physical body and affecting your mind by breaking the addictions or breaking that path of emotions and thoughts that we usually have, as we mentioned before. Again, meditation is the heart of breaking habits to purify the mind and to take care of the day-to-day affair, as Yogi Bhajan mentioned it. So the benefits is you don't need special equipment. You can do it anytime. Just reserve yourself in a quiet place for a good 15, or maybe start even with 5 minutes, 3 minutes. It doesn't matter, but just get into a place where you are in a non-judgmental point, where you can remain calm, not reactive to any situation, and being able to, as this internal dialogue comes up, being able to acknowledge and let it go. Usually people say, well, do you pretend that it's not there, that those thoughts are not there, or that anxiety is not there? No, we are not pretending that it's not there. We acknowledge that it is there, but we also get to the point where we can let it go. And that's what meditation really does. And when you start practicing over and over again, you can see the benefits that are just innumerable. What else? There is also some meditations that are used, and some mudra that it's used in for negative attitude, for depression. I just put one over here as an example. You can see it where you can put your pinky finger and your thumb together on both ends, and you can move it in a forward circular motion, rolling over each other with the palm of your hands facing downwards, right by the heart center. That's where the heart chakra is. For those of you that have done yoga or Reiki or other chakra words. So this is another one for those modality. Again, doesn't cost anything. There's no negative side effect. Worst case scenario, people might find it, silly at first. They'll say, I don't know if it works or not, but what the heck? You got nothing to lose. Try it. It's not gonna contraindicate with any other drugs that you're taking or anything else. If anything, you might get some benefits, and that's a bonus. Prayer, meditation, and mindful. What is the difference between prayer versus meditation? I find this one quote that I really like it. Prayer is when you talk to God, or again, you get substitute God for your higher self, your higher belief, whatever you are comfortable. And is when you can actually quiet down your mind and listen to the message that God or the universe has given you that. I like this quote from Lao Tzu. It says that, we have to watch our thoughts because they become our words. The words become our actions. The actions become our habits. Our habits will eventually become our character, and the character really becomes our destiny. So when you go back, it all starts with a simple thought that our mind is so powerful that it can change your destiny. Some of the reference that I've used in this presentation, you can take a look here. Some of the books and articles. Of course, this will be also available for the members to go back and take a look at it later on. Or reference. And of course, one last thing that sometimes we forget, and I would like for you guys just to take a few seconds and read it to yourself, a quote from a doctor about connectivity. So, to me, that's probably the place where we should start. So, thank you. I'd like to